Good morning, this is Dr. Samalot. Here, today we're going to be talking about exercise. Now, exercise, how it relates to diabetes. As you can see, I'm walking today, kind of a brisk walk, and it's raining. Not a lot of people come out when it's raining. But I'm out doing exercise, and it's not very common in Florida to do that. It's not very common to go out and exercise in the rain because we're used to Florida being sunny and you do things when it's sunny out or good weather. The thing is, you have to do exercise every day. There should be no excuses. I mean, unless there's a hurricane coming down or something, exercise is extremely important, no matter what time it is or what day it is. Now, how does diabetes relate to exercise? Well, how does exercise relate to diabetes? What it is, it's a numbers game. If you put in X amount of calories in your body and your body only needs a certain amount, and you put a little bit more than what you should have, then that excess is going to start accumulating in your liver as glycogen. And if that glycogen starts filling up, because your liver could only hold so much glycogen, after that it spills out and back into the blood. And when the sugar's in the blood, then it will trigger insulin. It's going to trigger the beta cells in your pancreas to start making insulin. So now this insulin is going to tell all the other cells in your body that have the ability to take up glucose or take up other energy molecules. It's going to tell them to go ahead and take them up. Now, the fat cells, like in the belly of men and the hips and women, they're going to be taking up as much as they can. The muscles are going to start storing glucose as well. And if you do this every day, and the end result after a few decades could be obesity. So, in a sense, the problem with diabetes is not so much that your body isn't working. What's going on is that it's working too much in the issue of storing the sugars. So, what we have to do is we have to give it less sugar. And even at that, when you give it less sugar, the exercise will also help you decrease the amount of sugar that is in the blood, and it's going to help decrease the amount of insulin your body has to make, and ultimately it will also teach your muscles how to use the energy more efficiently. You'll make more mitochondria in your muscles, and that way you can as you exercise more, you get used to it. It becomes easier. Exercise also is really good for a lot of other things. It's really abundant in all the things that it does. It's a form of getting endorphins. If you get used to exercise, you will feel great after exercising and during exercising, because it does release endorphins. There is a little bit of microscopic tearing going on in the body as you exercise, and the way the body masks this is by giving you a little bit of endorphins. So yeah, you do get some feel-good chemicals out of it. So that's great. That is really, really good. You also oxygenate your body. Now, a body that is rich in oxygen has a really hard time growing things like tumor cells, cancer cells, and other nasty creatures such as fungi. Fungi typically need an anaerobic environment, and with oxygen present, then fungi won't have the ability to grow. But there's other bacteria too that won't be able to grow. So a lot of the pathogenic bacteria are typically aerobic bacteria. So exercising increases your oxygen levels. It will decrease your sugar levels, and it will give you endorphins, so it'll make you feel good. One other thing that the exercising does is it tells your body to use up the triglyceride, the fatty acids of your triglyceride molecules. So essentially you will be also lowering your triglycerides. So I can't say enough of how important exercise is. Now, if you are in an obese state or in a state of arthritis that you won't be able to exercise, then you have to be very cautious of what kind of exercises you do, because you can make yourself feel worse. And if you have certain arthritis that you won't be able to, you just won't be able to recover from, in a timely fashion. And it can take months if you have ligament injury, things like that. So you have to be very careful. You have to work your way up to exercise. So the important thing with exercise is to, one, dress properly. Have good shoes, good sneakers, or whatever kind of footwear you like. If you're not used to exercising, then make sure you get good, comfortable sneakers. The other thing is you want to have proper clothing. Like today, it's raining, so I have a kind of a semi-breathable rain suit on. Also have a hat on, because it will get windy and it will get a little bit cold at times. You also want to go at a pace that you're comfortable with. You want to get more aerobic. The aerobic type of exercise is what is able to really use up a lot of your fat stores and a lot of the sugars. If you start lifting weights or doing really strenuous exercises, be it what they call the isometric exercises, then those start going into a different type of energy production. Those will go into anaerobic respiration, and those will build up a lot of lactic acid. Now, the problem with lactic acid is that it will breed a foundation for pathogenic bacteria, pathogenic fungi. It will not increase your oxygen levels. Is it completely bad? No. You actually need it, because it's the only way your muscles are going to grow and be stronger. But if you're in a fat loss program, if you're in a weight loss program, then I really suggest you be very careful with anaerobic exercises, the isometric exercises, the stuff that makes you strain, your muscles strain really hard, make you stronger, because it will actually make you hungrier. And if you're in a calorie reduction regimen, then that's exactly what you don't want to be into. You don't want to be starving you don't want to be feeling that hunger all the time, and that hard exercise will actually do that. Now again, there's some exercises that are really hard on people. Like if you have bad knees, then walking long distances is going to be problematic. So there are therapies for arthritis, but one really good thing for arthritis is to increase your stem cells in your blood. And how we do that is, first you got to fix your blood. We got to see what your blood looks like under a microscope. Is your blood completely filthy? Is it not behaving properly? Is it all sticking together like glue? Or are your blood cells acting increasingly better with time? Are they getting healthier? Are they bubbling? Are they bouncing off of each other? So these are things that these are clinical tests that we have to run to see what your blood is looking like. Because there are stem cells in your blood. These stem cells have the ability to regenerate a lot of our damaged tissues. So really important to not do this alone. Here at Harmony Clinic, we also specialize with degenerative musculoskeletal diseases. So we definitely have a lot of patients with arthritis. We have a lot of patients with degenerative disc disease, all the way from their neck to their coccyx, to their knees, to their elbows, to their shoulders. And we treat a lot of these conditions through chiropractic care, but we also have medical doctors that can treat a lot of these conditions with other natural medical ways to go about it. A lot of our medical doctors work with a lot of natural natural therapies, injectable natural therapies. We have injectable collagen. We have stem cell injectables. We have PRP, which is a natural form of getting your own stem cells and concentrating your own stem cells and re-injecting those. So there's a lot of therapies that we can do. We always start things through the least invasive. We always want to give the body the benefit of the doubt that all is what's going on is that the body is under a deficit. So we want to find out what the deficit is in the body and supply this to the body. So these are labs that are available today for the general public. We no longer have to live in so much pain from a lot of these debilitating diseases. Arthritis, diabetes, obesity, cardiovascular. These are a lot of these diseases that we can treat with a good amount of. We have a good success rate. Now, do we heal everybody? No. The philosophy is that almost every disease is treatable, but not every person is treatable. When you begin with therapy with us, you have to also be in the support groups. And the support groups is where you're going to get the majority of the education that we have available to you. So please do yourself a favor. When you're getting therapy, make sure that your clinic has a strong support group. So please check out our website. Look at all the different treatment plans that we have available to you. And give us a call. Make an appointment as soon as possible. Make this new year the year that you're going to be healthy. The year that you're going to be yourself again. The year that you're going to be what you used to be. Dream the way you used to dream. Live the way you used to dream. Plan in the future. And all these things that are good that God wants us to practice. We're meant to be happy. We're not meant to be diseased. Our bodies just need to be worked a little bit, but they all have the capability within themselves to heal itself. And that's what we're doing here. We're just healing the body. So until next time, this is Dr. Leonardo Samolot, wishing you all the health in the world.